My name is Joan Leitzer. I'm a medical doctor, a psychiatrist in Portland, and have practiced psychiatry for over 25 years. I'm also the mother of 2 grown children. I'm here to oppose all 3 anti-abortion bills today. The one that I'm going to talk about that I find very objectionable as a physician, I find them all problematic. But the one I'm going to talk about is LD 924, that would require that doctors read a government-approved script to any patient seeking an abortion. As a physician, I have an obligation to provide scientifically and medically accurate information to my patients, and an ethical obligation to ensure that patients give informed consent prior to any treatment. And this means that patients must have the capacity to give consent. Consent must be truly voluntary, and a patient must be provided with adequate, accurate information to make decisions. LD 924 is counter to the concept of informed consent. Indeed, it contradicts this principle by introducing elements of bias and coercion into the process. Counseling is not reading a government-approved script to a patient. It is definitely not reading inflammatory anti-abortion language to a patient in an attempt to coerce or shame her into not having an abortion. I understand that the Maine Right to Life Committee states that this bill was, and I quote, modeled after legislation which has been successfully brought forward in other states, Missouri, Texas, South Dakota, and Georgia. However, the scripts developed by government officials in these states contain false, misleading, and out-of-date information, including the false assertion that abortion causes negative and only negative emotional responses. I refer people to a very good article in the New England Journal of Medicine in January of this year, where Monk Olson demonstrate no support of the hypothesis that there's an increased risk of mental disorders after a first trimester abortion. In other words, there is no correlation between abortion and depression, or for that matter, any other mental disorders. The misinformation contained in brochures from the states that some would want to model a proposal after seems designed to convince women that abortion is wrong. Promoting an anti-abortion viewpoint through a government-issued brochure contradicts our obligation to patients. There is no need, I would suggest, to single out abortion and treat it differently than any other medical procedure that is a legal medical procedure. And I strongly believe that the legislature should not impose a set of religious or moral views on women seeking abortion. I therefore am here today to oppose LD 924 and the other legislation that we discussed this afternoon in committee. Thank you.